I attended dental school at Washington University in St. Louis, which is close to the hometown I'm from. And then I did my residency down at Parkland Hospital, which is a county hospital for Dallas, Texas. We also covered the Fort Worth County Hospital as well as the VA and the Children's Medical Center. At the time I attended there, it was one of the biggest trauma centers in the country. We did a lot of facial reconstruction, cleft lip and palate, dental implants, a lot of elective jaw surgery, craniofacial surgery. The patient experience at North Florida, I think, has been, we put a lot of time into training our staff to try and deliver, you know, what the industry calls good customer service. But I think basically it comes down to treating them as if they're family members, making sure that they're comfortable with their surroundings. As you can see from the office behind us, we've tried to make all the settings warm and familiar rather than clinical in nature. When you're dealing with nervous patients, I think there's two different ways that we can work with those patients. One is to actually just slow the appointment down, make sure that we have a chance to sit down and get to know them, they get to know us, and we do that with all of our patients, the nervous ones and the ones that aren't. If they still can't get comfortable with the situation, being oral maxillofacial surgeons, we have a lot of things at our disposal. We can use nitrous oxide anesthesia, we can even put them to sleep. Having done a hospital-based residency, we have training in general anesthesia, and so the patient can be completely unconscious if that's what's going to make them at ease. When we're talking about technology and recent innovations in oral maxillofacial surgery, some things haven't changed much. But for instance, one of the more cutting edge things that we have now is a CT scanner. The x-rays that we took years ago were two-dimensional in nature, but you're dealing with a three-dimensional situation. So the CT scanner can give us a three-dimensional image of what you have as far as bone volume or tumor or lesion, implant position, and we can use that to treatment plan placing implants. One of the activities I was involved in outside of our office practice was being on the cleft lip and palate team here in Jacksonville. The cleft children are children that have been born with a congenital defect, which can be anything from a hole in the lip all the way through the hard and soft palate up into the nose. So they have all kinds of problems with speech, appearance, eating, swallowing, and they need a large number of procedures performed between birth and their teenage years. My role with the team was essentially to do the bone grafting and the facial reconstructive surgery for these children. It was a great group of people to work with. They had a lot of needs, and they've been through a lot. They need somebody to help them, and so I did that for almost 10 years.